Hi, I'm Dr. Stephen Goldstein, and this is another in our series of reducing the confusion in gynecology. What I wanted to talk to you about now has to do with what I call breast imaging. In this country, stage 1 breast cancer has a 5-year survival of 99%. But that kind of early detection, when there's maybe a 5-6 millimeter mass, you lose one lump, one lymph node. Nobody in my practice has died from stage 1 breast cancer, and I can't remember how long, but that requires early detection. And I like to say I'd like the breast imaging people to pick this up 4 years before you or I could have palpated it. So it is important, beginning in average risk people at age 40, to have periodic screening. That means either 12, 18, or 24 months. Over age 50, screening annually. And if you have a history of breast cancer in a premenopausal first-degree relative, we would start screening 10 years before their diagnosis. For instance, if your mother was diagnosed at age 44, we would start screening you at 34. And this is separate from the genetic forms or the BRCA, BRCA mutations that can cause breast cancer that cluster in families. That's a whole nother conversation. In our hands these days, breast imaging implies mammography and breast ultrasound. Some of my patients like to do each of these 6 months apart because they feel like they're doing something every 6 months, but they really look for different things. And so doing them simultaneously in one visit makes sense. Especially in younger women who have dense breasts, ultrasound is extremely important. But understand that ultrasound is operator dependent. It's only as good as the equipment and the people performing it. The new 3D mammography or tomosynthesis, if you're really competent, should be pretty uniform among people who are really good at reading it. But it's important to keep up on your breast imaging. For many of my patients, the psychological aspects of having that diagnosis, even though it's a stage 1 breast cancer that they will survive, can be more devastating than the physical reality. So let's make sure, it's a very prevalent disease. Let's make sure that what we see is early stage 1 if it's going to happen at all. Thanks.